Patients. Patients need to be seen by qualified providers. Different challenges are faced for a rural versus an urban environment facility. There is no magic bullet. The problem is facilities' ability to actually bring in talent. Providers are just essentially getting older, retiring, and we're not replenishing and seeing that in the line of the residents that are now coming through. People are concerned about their quality of life. Since COVID, providers had a moment to pause and realize it's not just the patient that matters, it's also myself and my family. And that's something that previously before we have never seen happen. That's affecting every health system, whether you're in a rural environment or an urban environment. There are more people that are getting sicker. The sheer volume is overwhelming the providers that are there, even the spaces of the facilities. I visit a lot of sites myself in person, and they're all talking about how do we expand, where do we expand. Those are the biggest factors I feel like are driving the recruitment challenges and staffing challenges. Forward-thinking strategies that these different health systems should be utilizing to make sure their recruitment is always top of mind and they're putting themselves in a better position tomorrow than they were in today. Telehealth. You need to start actually having a very comprehensive telehealth program put into place for your top service lines. Every week, I'm doing some kind of consultation, sharing with a client about a different service line. They didn't realize what they were capable of providing care in telehealth. So that's number one. Number two is you got to use advanced practitioners. We have more advanced practitioners graduating every single day than we do have physicians. So eventually that number's going to outpace it. You have to utilize what is actually available that can do good today, as well as also just flat out using locums. I just met with a client. Their facility is actually really embracing the whole idea that work-life balance is key to recruit and grow their different service lines. It was like, we need to have a bench of locums ready in every service line, and we need to be able to share that with our new recruits and people that we're trying to bring in so they know this is a facility that's actually being proactive and taking care of my work-life balance. I no longer have to feel guilty like patients will no longer get their care because I'm not there. So I think that's a really cool thing that I'm starting to see happen.